Hello and welcome to my series of videos on the muscles of the body. This is the first video in my series on the trapezius. My name is Mark and let's get into it. Before we dive into muscle contraction of the trapezius, we should first review our anatomy. The proximal attachments of the trapezius, also known as the origins, include the nuchal line or the nuchal ligament, and this extends from the external occipital protuberance to the spinous process of C7 of the vertebra. The external occipital protuberance, which is a bony prominence located on the occipital bone, and the spinous processes of C7 to T12. The insertion points, or the distal attachments, include the lateral third of the clavicle and the acromion and spine of the scapula. The trapezius is innervated by the spinal accessory nerve. A simplified definition of muscle contraction will tell you that when a muscle contracts, it will shorten and tighten. This tightening or shortening will occur in the direction of the striations of the muscle fibers. So based on this information, which of the following movements will the trapezius cause the scapula to perform? A. Internal rotation, B. External rotation, C. Upward rotation, or D. Downward rotation. Please pause and try to find the most logical answer based on your knowledge of muscle contraction and the movement of the scapula. If you would like to review scapula movements before answering this question, I made a video that's available in the description that goes over all of the possible scapula movements. Did you pause? What did you find? So based on our knowledge of scapula movement, we can throw out the first two answers. The scapula does not participate in internal rotation and external rotation. As far as narrowing the answer down between upward rotation and downward rotation, we need to think about the origins and the attachments of the trapezius to the scapula and how that would affect the movement of the scapula. We're going to superimpose a cartoon animation of a black scapula and a green trapezius over this textbook image. As the trapezius contracts, the distal attachments of this muscle to the scapula, which include the acromion of the scapula and the spine of the scapula, are pulled in the direction of the striations of the trapezius. This causes the glenoid fossa to point upward. Therefore, we have upward rotation. We can deduce other movements of the scapula via the trapezius based on our knowledge of origin and insertion points. The upper fibers of the trapezius will cause elevation, while the lower fibers of the trapezius will cause depression. In addition to elevation, depression, and upward rotation, the scapula also participates in retraction as a result of trapezius contraction. Since the origin points of the trapezius are posterior with respect to the sternoclavicular joint and medial with respect to the insertion points of the scapula, contraction of the trapezius will cause the medial border of the scapula to move toward the spine. hence retraction of the scapula. And that is all. I hope that you have a better understanding of the trapezius from watching this video. I wish you good luck with your studying, and goodbye for now.